Yeah.
We all know about laparoscopic surgery. For like last 10 years, ये चर्चे में है कि laparoscopic surgery क्या होता है. एक और कुछ ज़्यादा छोटा सा holes होता है, उसमें surgery हो जाता है. Sir, what makes the next level robotic surgery? Like everyone is like talking about robotic surgery. Is it more finer and more hassle-free? What's robotic surgery?
Right. So to understand this question, we need to step back a bit. So we need to understand what minimal access surgery or minimally invasive surgery means.
Yeah.
See, if there's a problem, I'll give abdomen as an example. Okay, minimal access surgery is a general term. You can use that for surgery in any part of the human body. But because I'm a GI specialist, I want to explain this from the perspective of abdominal problems. So if there is a cancer of the colon or a cancer of the stomach, the traditional way of doing it is by opening the abdomen and removing the cancer. So that's open surgery. Minimal access surgery is when you perform the same operation by making just holes in the abdomen instead of making a big cut. So the operation that you do inside is exactly the same.
Okay.
Exactly the same, but the approach is different. Instead of making a big cut, you just make few holes. And this minimal access surgery in the abdomen is what was known as laparoscopic surgery. I mean, laparoscopic surgery is not new anymore.
Right,
I mean,
yeah.
if you think about it, the first laparoscopic cholecystectomy was done in 1985. So it's almost 4 decades now since laparoscopic surgery came into the field of GI surgery. Over a period of time, a lot of advancements have happened in the field of laparoscopic surgery itself. And then a new aspect of minimal access surgery came in. You could perhaps call it as an evolution within the field of minimal access surgery, and that is robotic surgery. So how is it different from laparoscopic surgery? Essentially, this also involves holes in the abdomen. But instead of the surgeon introducing long, slender, straight instruments and performing the operation, the surgeon introduces robotic instruments. And these robotic instruments are so different from the laparoscopic instruments. I mean, the dexterity of these instruments is better, the angulations are better, and we say a robotic instrument mimics the human wrist. And we even call it as an endo wrist.
Okay.
A robotic instrument is called an endo wrist. It has 7 degrees of freedom. As a result, we are able to operate in a more precise fashion, and we are able to operate in areas which may be quite difficult to access with laparoscopic instruments. And lastly, the cameras which come with these robotic systems are all very sophisticated cameras, and we get a lot of
magnified
views. I mean, it is said that the vision that we get in the robotic console is about 10 to 14 times magnified, and you get a 3-dimensional effect as well. As a result of this, we are able to offer our operations in a more precise way and give better results.